Welcome to week 2 overview. This week we're going to cover chapters 5 and 6. Chapter 5 is the introduction to ICD-10-CM, which is our diagnostic code set, right? You learned that in week 1. Very good. So I want to cover a few basic points about your ICD-10-CM coding manual. So grab your ICD-10 coding manual and let's take a look at and see if we can locate the alphabetic index and the tabular list. Now, guys, stay with me here because I'm going to be switching back and forth between the PowerPoint and a camera that has the ICD-10-CM coding manual. So hang in there with me. Give me just a second. Not wanting to cooperate. Here we go. Now, this is your ICD-10-CM Expert Coding Manual. As you can see, it's the 2025 edition. Everybody should have a copy of this in hand, hard copy. Now, when you open the cover, I want you to notice the first thing that you will see is the official guidelines. Because this is a very introductory level class, we're not going to spend a whole lot of time here. I just want you to get used to the coding manual and how to navigate the code book. All right, after the guidelines, you will see you have some lovely illustrations of the anatomy of the body. Take time to get used to that and see what you have there. Just explore your coding manual. That's the way you get to know it. Then after your illustrations begins your alphabetic index. If you notice this at the top, it's named ICD-10-CM Index of Diseases and Injuries. We call it our alphabetic index, and this is your beginning points. This is where you start to code. All right, after the alphabetic index, if you will notice when I hold up the sides of the edges of the pages, they're color-coded. This is what is known as your tabular list. So see if you can find the beginning of the tabular list. All right, do you see this? All right, now actually your alphabetic index is the roadmap to get you to the right place within the tabular list. What we're held accountable for in coding once you become a certified coder is the tabular list. Okay? You never ever code from the alphabetic index. You always verify the code in the tabular list before you assign it. And if you notice the tabular list, you notice at the top, you have the codes that are on this page. It's set up very much like a dictionary. You have your codes up the top that's on this page and on the side. And as I said before, it is alphabetic. The codes always begin with a letter of the alphabet. It is an alphabetic order followed by numbers. So A, and then the B set of codes are after that, C codes, and so on and so forth. As you can see, the codes are on the side of the page as well as the top here. So take a few minutes, put the recording on pause as I switch back to our PowerPoint, and take a minute to get used to the coding name and how it's laid out. All right, I am back to the PowerPoint. Everybody knows where your alphabetic index is? Fantastic. Everybody knows where your tabular list is, right? Excellent. Now, the tabular list always begins with the letter of the alphabet, right? Followed by numbers. Now, let's put this into practice, shall we? All right, so as we begin to learn to code, we are going to have what we call documentation from our healthcare providers. In the beginning, we start with short statements like this. A patient is diagnosed with what? Asthma. What type of asthma? What else do we know about it? It's mild intermittent, correct? All right. So what you're going to look up in your alphabetic index is what? What does the patient have in the broadest sense of the term? They have asthma, correct? All right, and it is what? Mild intermittent. All right, so let's go to our alphabetic index and switch back here. So we're going to our alphabetic index and we're going to look up asthma. All right, see who can find it first. Asthma. And let me adjust my camera so y'all can see this a little bit better. Okay. Can you see asthma? And what else did we know about it from our documentation? That it was mild intermittent, right? So asthma. So let's look down the list to see if we can see mild intermittent. Do you see it right here? What's your code? J4520, right? Can everybody see that? Excellent. So each week you are going to have approximately 15 questions that's going to ask you to identify the main term and the code. And this is how you're going to do it. The main term here is, did I hear somebody say asthma? Excellent. And your code is what? What is your code? It's right there on the screen. J45.20. Now that you have that, let's turn to our what? Can we code from the alphabetic index? No. So we have to turn into our tabular list to J45, right? You see how I'm just flipping through here till I find J45. Okay. J, see if that's showing on the screen. J44. I'm looking for J40. There we go. Can everyone see this? J4520. Now read the code description. Mild intermittent asthma, uncomplicated. Perfect. That matches our documentation spot on, doesn't it? Excellent. So you're ready to fill in your blank. Main term, asthma, code J4520. What do y'all think? Congratulations, you just coded your first case study. All right, let's go back to the PowerPoint. So that was our first one. Let's try another one. Okay. Patient is seen for a sore throat. So where do we begin? Alphabetic index, right? So look for your alphabetic index. And what is this about? A sore throat, right? So look up throat. Okay, did you find it? Take your time. If you need to put the recording on pause, do so. Okay, if you found throat, what does your alphabetic index tell you to do? It tells you to see condition, right? Okay. Now go back to your medical terminology days. Reach back in your memory. What is the medical term for a sore throat? Did I hear somebody say pharyngitis? Excellent. The medical term for a sore throat is acute pharyngitis, right? So let's look up pharyngitis. That's the condition. Okay. Did you find pharyngitis? Okay. Pharyngitis. Now notice acute is beside it in a parentheses, right? Now if you look just underneath that, you will see the code. Let me turn the camera on for you. Give me just a second. And if you notice right here, do you see pharyngitis? And in parentheses beside it, you see acute. And you read down, and your code is J02.9. Does everyone see that? So what's your main term? Pharyngitis. Your code is J02.9. Okay. Now, do we need to verify that in the tabular list? Absolutely. So go back to your tabular list, and we're looking for J02. J02.9. Here we go. Does everybody, whoops, on the count, there we go. Does everyone see J02.9? Acute pharyngitis unspecified. That is, and if you look down here, it says sore throat acute. So you know you have the right code. Do you feel confident in assigning that? All right, excellent. All right, let's try another one. All right, our next case study is what? Patient presents with a headache. In the broadest sense of the term, what does the patient have? A headache, right? So look up headache in your alphabetic index. Find it. Did you find the headache? What's the code? Do we know anything else about the headache? It's just a headache, right? So what is the code that you found that's beside it? Did everyone come up with R51.9? Excellent. So your main term is headache. Your ICD-10-CM code is R51.9. Now take a minute to turn to your tabular list and look up R51.9 to make sure it does it. What do y'all think? Do you feel confident in assigning that code? Do you see R51.9 right here? Headache unspecified. We don't know anything more about it except that the patient has a headache. And that code fits it perfectly. Did everyone find that successfully? All right, very good. Let's set that to our PowerPoint. And let's try the tabular list. Now, you've already found out, right, that the tabular list is in alphabetic order by the first character. Then it's followed by the numbers. Okay. Now, you will also have questions presented to you this way as a multiple choice question. The patient presents with acute what? Bronchitis due to what? Mycoplasma pneumonia. Which of the following ICD-10-CM codes is most appropriate? Now stop and think, how are you going to approach this? You have the codes listed below. It has to be one of those, right? All right, so see if you can find your J codes in your tabular list. This is going to be in your tabular list. All right, now do you have the documentation in your mind? Acute bronchitis due to what? Mycoplasma pneumonia. Okay, let's stop sharing there. Now you saw your codes that you had to choose from. Okay. let's look at what our coding manual has to say. Did you find code J20.0? Look at this one. J20.0. Can you see it? Now notice at the top, you have your codes on the side of the pages. Are y'all starting to learn to navigate correctly? Also at the top. All right. So one of the codes suggested was J20.0. Look at what the code description says. Acute bronchitis due to what? Mycoplasma pneumonia. It fits perfectly, right? Another answer option was J20.6, acute bronchitis due to what? Rhinovirus. That doesn't fit, does it? Okay. What about J20.9, acute bronchitis unspecified? Look, it's kind of in the neighborhood, but it leaves out part of the story, right? J20.0 is much more specific and matches our documentation exactly. So your answer would be J20.0. Does everybody see how I did that? All right, let's try one more. So your answer to this would be J20.0. It matches our documentation exactly. All right, let's try this one. A 35-year-old patient is diagnosed with what? Iron deficiency, anemia secondary to chronic blood loss due to bleeding gastric ulcer. Now, what are they focusing on in today's encounter? Anemia, right? In the broadest sense of the term, that's what they're working on is anemia. And what is it from? Iron deficiency. And we also have to tell this part of the story that it's chronic due to chronic blood loss from a gastric ulcer. Right? Again, look at your answer options that you have to choose from. 3 of those begin with D. So I'm going to navigate, excuse me, to codes in the tabular list that begin with D. All right. Did you find D50.0? Look at the code definition for D50.0. Iron deficiency anemia secondary to blood loss, chronic. That's exactly what our documentation states, right? So that is a very viable option. But let's check out the others just to make sure. Look at D50.2. I don't know about you guys, but I can't find a D50.2. So that's an invalid code. So we will move on. Look at D50.9, iron deficiency anemia unspecified. Now we know what it's coming from, right? So D50.0 is much more specific, correct? So far, our best option is D50.0, but let's also look at code K25.9. See if you can find K25.9. Does everybody see that? What's the code description for K25.9? Gastric ulcer unspecified as acute or chronic without hemorrhage or perforation. Well, our patient does have a gastric ulcer, but that's not what the encounter is focusing on today, right? They're focusing on the anemia. The diagnosis is iron deficiency anemia. So what is your correct code here? Did I hear someone say D50.0? Excellent. How are y'all starting to feel about navigating the tabular list? Not that bad, is it? Let's try one more. A patient is seen in the clinic for type 2 diabetes mellitus with diabetic polyneuropathy. Which is the correct ICD-10-CM code? All right, if you notice, 3 of your answer options begin with E11. So let's see if we can find E11 in our tabular list. find it? And the first one is E11.9. I'm going to give you a second to get there. Type 2 diabetes mellitus without complication. That's E11.9. Okay, it's in the neighborhood, right? But we need to get a little bit more specific. Now look at code E11.40. Type 2 diabetes mellitus with diabetic neuropathy unspecified. Good. It's getting a little bit closer, right? But let's look at the next one. Type E11.42, type 2 diabetes mellitus with diabetic polyneuropathy. That's exactly what our documentation states, right? So that is our best answer so far. But I also want to look at G62, just to make sure. See if you can find G62.9. All right, did everybody find G62.9? Polyneuropathy unspecified. That only tells part of the story. So what's your correct answer here? E1142, right? Excellent, excellent. All right, that is a good introduction for you for chapter 5. Let's head into chapter 6. We're starting to get a little bit more specific here. Coding infectious diseases. This chapter is going to cover things such as inflammation, bacterial infections, viral infections, parasitic infections, and the list goes on. So that's what chapter 6 is focusing on. So let's put our practice, what we've learned so far about identifying the main term and the ICD-10-CM code. Our patient is diagnosed with acute viral what? Gastroenteritis. So what is your main term going to be here, guys? What are you going to look up in your alphabetic index? Did I hear someone say gastroenteritis? Excellent. That's exactly right. And what do we know about the gastroenteritis? It's viral and it's acute. Take your time. See if you can identify the code in the alphabetic index. I'm going to give you just a moment. Did you find it? I'm going to give you just a second. All right, let me show it to you with the camera. Give me just a second. Switch over here. Give it just a minute to get in focus. Come on. Not going to focus for me. No. All right, did everybody find gastroenteritis? It's right here. And then come down, wait, and acute is here in the parentheses. And then if you come down to viral, what is your code there? A08.4. Can everybody see that? I know the screen has gone. If that's it. Did everybody find it? All right, fantastic. Let's go back to our. All right, so you have your code for that. Are you starting to get the idea? All right, the patient has what? Streptococcal pharyngitis. What is the main term that you're going to look up in your alphabetic index? Pharyngitis, right? Because in the broadest sense of the term, that is the condition the patient has. What else do we know about it? Streptococcal, right? Okay. So look up pharyngitis in your alphabetic index and then go down to streptococcal. Put the recording on pause until you get your code. Did you come up with a J02.0? Excellent. All right, let's try one more. Patient is diagnosed with acute otitis media suppurative right ear. What are you going to look up in your alphabetic index? What does the patient have? Otitis media, right? So look up otitis and then go down to media. And then underneath that, it tells you to see suppurative. So look up otitis media suppurative. Make sure you get the correct laterality in. We want to make sure we pick up right ear. Now, if you notice on that code, do you see in your alphabetic index where it has H66.00? And then there's a little box beside it with a check mark in it. All right. So let's turn in our regular list to H66.00. Let me know when you get there. H66. Is everybody at H66.00? Now, do you see how it's just indented just underneath it? And look at H66.001. If you notice, that identifies the right ear. Look at the code just below it, H66.002. If you notice, that's the left ear. And H66.003 is bilateral. But our documentation states right ear, so our code is going to be H66.001. Is everybody good with that? All right, fantastic. All right, let's try this one. In the tabular list, now you're turning to your tabular list, your patient is diagnosed with Salmonella enteritis. What is the correct code? I'm going to give you a minute to work through this and see if you can come up with the right code. Put the recording on pause until you make a decision. Did you come up with code A02.0? Did that match your documentation exactly? Salmonella enteritis. Now, I would double check. I would look at A08.4. And what is A08.4? Viral intestinal infection unspecified. The neighborhood, but that's not what our documentation is about, right? And we know what are J codes for. Do you remember? Are you starting to pick up the body systems? J code is for respiratory, right? So we know it's not going to be J18.9. And what about B50.9? Let's look that one up. B50.9 is malaria, so it has nothing to do with salmonella, right? So what is your best code? What did you decide on? A02.0. Excellent. All right, try this one. Which code is assigned for infection due to what? Methicillin-resistant Staphylococcus aureus, or MRSA, okay? Unspecified site. Take your time. Take your time looking up your codes. Put the recording on pause until you make your determination. Did everyone decide on A 49.02 methicillin-resistant Staphylococcal aureus infection, unspecified sites. Okay. Is everybody good with that? Do you feel confident in that code? Very good. Excellent. All right, let's try one more. Okay. Last one for tonight. The patient is diagnosed with what? Tick-borne Lyme disease. Go ahead, put the recording on pause as you look at each and every one of these 4 codes to make your determination. All right, did everyone come up with A69.20 Lyme disease unspecified? That is perfect. All right. B20 is what? HIV. A48.3 is toxic shock syndrome. And what's A15? Let's look at A15 just to make sure. A15 is respiratory tuberculosis. So we know that's not it. So the code that accurately describes our patient condition is A69. All right. I hope that has helped you to get started on your assignments this week. Remember, I am just an email away. If you have any questions, do not hesitate. And I will give you a quick tip as we part for the night. Please, as you're entering your answers for your homework, make sure you are spelling and typing correctly. If you put an extra blank or an extra letter in there, the system will mark you wrong. Remember, you have unlimited attempts on your homework. You do have the feedback, so please take advantage of it. Again, if you have any questions, don't hesitate to let me know. Happy coding, everyone.